Hi guys, today first of all I want to say Happy Hanukkah, Merry Christmas and Happy New Year. It's going to be probably our last podcast in this year. We're going to start again a new year with a new beginning. Everybody healthy, happy. And today we're going to have our special guest, our very good friend, Dr. Viktor Pavlych, our beloved dentist. And we're going to talk again about dentistry, about life, about everything, hobbies, everything, whatever you like to listen. Here, we're going to start. Dr. Pavlych, Dr. Viktor, nice to see you.
Thank you so much for the invitation. Like you said, everybody, please have a happy holidays. You couldn't have said it better. Healthy is the most important thing. Healthy is the most important.
I mean, healthy teeth, it's good, but not for us. We need more teeth to do. But let's say, as we usually, we're going to start from the beginning. What happened that you become a dentist? How it's happened?
You know what? Sometimes I wonder myself. No, but in all the reality, it was interesting because coming here to the United States, we were very lucky to win the green card lottery, and came here in 1996. I was 18 years at the time. Coming here with a single mom, you know, it's a little bit of a challenge in itself. And then started working first, and then, as we all know, the dentistry was a little bit different back then. Back in Ukraine, started collected, saved some money, you know, and then started thinking about fixing the teeth.
Your own teeth?
My own teeth, exactly. And then she went first, my mom went first, you know, she did hers, and then I went, you know, and it was interesting. I liked it. It was different. Back then, we had no anesthetic, if you remember.
Yeah, I do.
It was a terrifying experience. And so this was a very different experience. You know, it was nice and pleasant, you know, you get numb, you know, nothing is hurting, you know, everything is fixed, and then you just live happy. And then for me, I was, back home, I was studying economics. I finished the first semester in State University in Uzhgorod, and then didn't really know what path to take. You know, coming here, I mean, started to work, started to make some money, and then my mom suggested, "Listen, Viktor, I mean, this is not a bad profession, you know, nice and clean. Why don't you try it?" And from her simple words, you know, it wasn't a simple path, but it took a little bit of time. But you know, year after year, more classes, more schooling. This is how it became.
What school did you go? I mean, what dental school did you go?
First started with the Wright College in Chicago.
Oh, okay.
I did there 2 years, community college. It was easy. It was close by, you know. And then transferred to University of Illinois Chicago.
Okay.
For undergrad, finished that, and then was lucky enough to get accepted to University of Illinois Chicago Dental School.
Because I know it's so hard to get to University of Illinois, right?
Oh my God.
Yeah. I know.
I don't even know. I mean, I'm still thankful, you know, how I was accepted to dental school. Finished that, and then I did an extra year. It's a general practice residency. I did it at Loyola.
Okay.
Yeah, and then it kind of escalated from then because it opens up doors to a lot of things.
Okay.
I worked at a Veterans Affairs Hospital at Heinz Veterans Affairs for 8 years. I was a coordinator for students, for residents, so a lot of people went through us, you know. We helped a lot of people. There were students from Boston University coming. I'm sorry, not from Boston University, from Boston, but from Tufts University.
Okay.
And then also from University of Illinois Chicago, students had rotations there. It was every couple of months, you know, they would rotate. Residents from Loyola University, they had rotations with us there. And overall, it was an interesting experience, very difficult cases, very interesting patients. It was good times.
Yeah, but how hard was to go from, let's say, from the college to, let's say, dental school? Is it a hard transition, or?
I would say yes. College was simpler, you know. Exactly. College was simpler. I mean, you went to classes, you took some tests. Dental school was different. You know, dental school was a real thing. It was you really need to learn, because I mean, the next thing you see is you have a patient in front of you, and it's a live patient, and you have to help the patient, you have to fix him. But it was interesting. The clinical aspect of dental school was very, very good. The didactic part was a lot. It was a lot. I don't know if the college prepares you really well for it, but dental school for sure does. And then the clinical part, the practical part of it was very
fun.
very,
Because when you came from Ukraine, you already finished high school there, right? That's mean for you. I know after our high school, it's much easier here to go to college because we know kind of a lot. But after you go from college to dental school, it's a different story because it's specific, it's specialization, right? Do you have like any interesting moments from dental school, like some funny stories or maybe hard stories? I don't know. I know because everybody from dental school, they all have different experience.
It was a different experience. One of my favorite ones was probably from surgery, because as we know, we do a lot of surgery in our practice right now. But how it started was very, very different. It was we had rotations in the surgical department, and at first, as you're a student, they don't let you do a lot. You observe, some things, and then once you become more experienced, they will let you extract some teeth, some simpler, then more complicated ones. I remember one of the first time I was standing there, and I don't know whether I was too tired or what, but I almost fainted.
Really?
The smell of blood, the whole experience. It was different. It wasn't really exposed to it before. And then the attending doctors, they were all making a little bit of fun.
Yeah.
You're a student, first year there, and that kind of pushed me into. I told myself, this is something that not going to stop me. And on the contrary, we do quite a bit right now of surgery. So that was one of the experiences that kind of stuck with me.
But after this experience, did you want to beginning your journey to be an oral surgeon, or it was probably too much? I mean,
you know what? It was a lot, especially back in those days. There wasn't not that much information available as it is now. You go on any forums, you go on any student portals. You can read up on a lot of things. Back then, it was really a word of mouth. You didn't really. There was not that much resources as far as the social media, as far as the internet and everything else. I did. Oral surgery interests me a lot, and I wanted to pursue it, but again, it's an additional 4 to 6 years.
Yeah.
And some of the things, as an oral surgeon, you're also limited, because if you're limited to oral surgery, the only things you can practice is oral surgery, but there are also other aspects of dentistry that really, really interest me as well. Cosmetics, for example, and just simple stuff as helping people with regular, cleanings, fillings, and crowns. It's as a general dentist, in the United States, you can do a lot as long as you know your limitations. And this is one of the other things that kind of. Didn't want to lose that aspect of dentistry, especially now that I've been practicing for almost 20 years.
20 years, wow.
No, actually, more than 20 years, 21 going on this year, and it's a lot.
It was like yesterday, right?
It was like yesterday, so true, Some of the things that I realize now is that, for example, when we do any kind of surgery, we kind of look at the final stage of how this should be, how the product should be, and going back from them, you can trace it back. And for example, if you're placing an implant, a single tooth implant, you really know exactly how you want to position it, so that the crown, when the final product is finished, is exactly at where you want it to be. I'm sure as an oral surgeon, you think of those things as well. But if you're doing everything from start to finish, you're responsible for everything.
Because you can plan, right? You can plan from start to finish. You know exactly how it's supposed to be, and it should be.
Exactly.
Yeah.
I mean, having done, and I'm not a neurosurgeon by any means, but we do a lot of surgery at the clinic.
Implants, right?
Implants, we do extractions, we do implants, we do simple bone grafting, sometimes we do some sinus lifting. But oral surgery is on a different level. It's more complicated cases. We work with a few oral surgeons, and they help us a lot. It's the cases that we cannot do. We're not supposed to be even doing them. And as long as a general dentist knows their limitations, they're
Perfect.
perfect. Exactly.
I know you have a couple offices, and these couple offices in different location. But for you, do you see any difference, like for the patient-wise, like demographic? Probably in Chicago, you have different work. In Schaumburg, probably have a different work too, because it's different patient, different
mentality, a little bit,
right?
A little bit. When I started the Chicago office, it was almost 100% Polish office.
Because it's in the area.
It's in the area, and a lot of Polish people living in it.
Our Polish friends, Dr. Victor, waiting for you.
Thank you. But demographics in Chicago, they change. The neighborhoods change, and people started to move out mostly to the suburbs. And for them, it was difficult to drive back to Chicago. I mean, imagine all this traffic and sitting in there. I mean, we've all been there. So a couple of years ago, I started to think, because that's one location, and people were complaining to me. Patients were complaining. Listen, it's too far. Is there any way? So we decided to open in Schaumburg, the Schaumburg location. We kind of looked at this sort of a central location for all our patients. That we did a small, like a graph of the demographics, and this northwest suburbs, Schaumburg in particular, because it's very easy access, and thankfully, the office, we were able to open a bigger office to accommodate more people, more doctors, more hygienists. As far as demographics, it's more or less the same. The procedures are more or less the same. I don't really see a big difference.
No big difference.
Not really, I mean, if you need a filling, you need a filling, whether it's in Chicago or Schaumburg,
Remove the tooth, yeah.
Exactly. But it's not a huge difference.
How was for you? It was hard. I mean, in the beginning, but when you were by yourself, you wake up like 5-4 in the morning, go to work. But after you got married, after you get kids, a lot of changes, right? And you still have to do the same kind of routine. Wake up in the morning, go to work, come back to work. But now, everything waiting for you. For them, it doesn't matter you were at work or it doesn't matter in the restaurant. They just came, right? It was harder, right? I mean,
it was. Oh my God, it was. I don't know if I'm sure the same.
I know, yeah. But I'm telling from my experience why I'm asking, because as I know, it's like in the beginning it was kind of and when they're getting older and still everything same routine, it's getting harder.
I wanted to ask you, because you have even more kids than I do. How is it possible to even to balance everything? I mean, what do you think of it? How do you do it?
Probably sometimes you think it's so hard, but after you have to just forget about it. Let's pretend you don't have a kids. In this period of time, you forget everything good. But when you're going home, say, okay, let's do that.
That's when
can I finish? Probably not, but you have to finish. Somehow, it's we can manage. We can manage.
You know what? This brings me to this point. This end of the year, especially this year. Oh my God! Everybody's trying to finish their, because dental insurance, everybody want to use their benefits, trying to maximize the most of it, and then at the end of the year, it just becomes so much. I mean, so much is the understatement.
Really?
Everybody want it. All the patients. You just don't. Sometimes people forget that we're also just humans too.
And it's only, let's say, 24 hours a day, right?
It became, So usually when you do, 8-10-hour day, these last days became, 12, 14-hour days. And it is exhausting. It is exhausting, And I think there's a fine line. Because you as a professional, there is nothing worse if you do something, something wrong, I mean, that's always scares me, and then you don't think about it. But if you're exhausted, something could go wrong. you know, and the patients also need to understand that too. You know, you're just a human, and to be on top of the game, you know, you have to be well rested. You have to focus, really focus. And dentistry is such a focus. You know, it's tiny. I mean, tiny mistakes. You know, I mean, it's not even mistakes, but tiny things could lead to
wrong way. Yeah.
The wrong way, exactly. And then, you know, I don't know. Especially, I don't know. This year it was something.
But
else.
let's say like 5 years from now, you're gonna say, this year was the hardest one. I'm gonna tell. Do you remember 5 years ago? But what we can say, our like listeners, our patients, for example, I know like by insurance you have to clean your teeth. I mean, by dentists twice a year, right? What the advantage to? I mean, some people never clean. Some people clean once a year. Some people, like me, I clean 4 times a year. Mm-hmm. Because it depends how you.
Exactly.
But usually 2 years. I mean, twice a year, right?
It's very individual. You know, individual. Yeah, patients that don't have any problems, yes, we recommend it twice a year. Not even just by insurance. It all depends on, you know, your saliva type. You know, how much plaque you get. Also depends on your home care. As far as the patients that have periodontal problems, it's a lot more than twice a year. Sometimes we even work with periodontists. You know, sometimes they see them for cleanings, and then they come to us for cleanings. Like within a year, they can have it even done 4 times. Like
really? It's not just me. Okay, it's a lot of people who have different issues.
Yeah, they really do.
Interesting. And what do you recommend to, like, let's say, young generation? Like, usually, if they start take care of their teeth, like in the beginning of, usually depends on parents. But if they good and they have to go when they're adults, they're gonna continue good work. What do they have to do? Like, let's say, everyday maintenance, for example, to keep. I'm talking about the food too and drinks too. What the
This is a very good point, you know, because very, very excellent point, Leo. Because people don't think of it that way, you know. Yeah, because they think, just brushing, you know, it's done. You know, I'm gonna floss once in a while. I'm done too. I'm gonna go see Dr. Pavlych and his hygienist, and we're good.
We're done.
A lot of acidity, you know, a lot of acidity that we see now, and it causes the enamel to weaken, which is the strongest substance, as we know, in our body. But what happens if it becomes weakened, if that pH of acidic versus basic, it changes, then this decay starts to happen. And this is, I mean, for me, it's one of the worst things that I see, you know, like young people coming, you know, and they already have starting decay between the teeth. That's what we usually check on the x-rays. And for me, the worst thing is to start drilling, you know, it's a good tooth, you know, it looks perfectly nice, but you know, but it's small, exactly. But you know what? These days, I see a lot of new products coming out, and we're starting to use some of those. We're trying to keep up with most of the new technology and products on the market. I think as a professional, any professional, we have to same as you, same as me, you know. But one of the newer ones that I really, really recommend, they cannot use it at home. It has to be in the office. It's called Curadont. And what it is, it's a combination of hydroxyapatite and fluoride, which prior components only had fluoride in it. Now they introduce hydroxyapatite, and you can place it between the teeth, especially for these, it's called the incipient decay, and monitor it. And this is, I think, far more superior than start drilling it right away, because once you drill it, that's it. The tooth is gone.
Gone. It doesn't matter, even small feeling.
The enamel is not there anymore. And then, you know, with the proper education for the oral habits, for the oral hygiene, and also for the not maybe drinking as much, I don't know, soda, energized drinks, sometimes coffee, lemon water, for example.
Lemon too?
Well, you know, people drink lemon water throughout the whole day.
You mean lemon like bubbly, or lemon
like a real lemon?
Really?
You know? I was surprised too, you know.
Because I know, like, they recommend, like, let's say every morning take a warm cup of water, just put a little like lemon inside, just to, I don't know.
Well, this is a great thing, you know, this is a great thing. And if you drink it just one time, you know, you drink it and you're done, okay? But some people drink it throughout the whole day. And that what creates the environment, exactly. Because if you just drink it once, you brush your teeth, you're done. You know? Once you keep drinking for the whole day, it doesn't matter that the acidity still stay there, and it starts to weaken the enamel. You know, I didn't think of it.
Me
also.
too. Yeah, I was. Oh my God, it could be me. Huh. But It's enough about teeth. It's only teeth. Nobody die. What I'm saying, but what do you like? What do you? I know family, kids. It's no question. It's the first hobby. But what else in your life? What your hobby after that? I know you like to ski.
I like to ski.
Yeah, I know you don't have a time, but I know from this region of Ukraine, where it's Carpathy.
Carpathian
It's mean
Mountains,
probably you did a lot of skiing there, right?
You
Or
know
not
what?
enough?
You're kind of, when you're born, you don't have a choice.
Oh yeah.
As soon as you're born, it's mountains everywhere, and you start skiing at a very, very young age. Skiing has anything to do with the snow.
Oh no. But how far was from you? Let's say if you want to go ski.
So the closest ones, because we lived in Uzhgorod.
Yeah, it's already there.
It's already up in the mountains. It was about half an hour drive, when you're in the mountains already. And then once you're in there, a couple more minutes and you're at the ski slopes. And it was very nice, especially when it's a Carpathian winter.
Exactly.
A lot of snow. But here it's the possibilities are more open, more available for skiing, whether it's in Canada or United States or Europe. It's very nice and it's relaxing too.
Really? But what is your favorite spot, let's say in United States?
United States? Probably the Utahs.
Utahs.
Yeah, Utah mountains. So nice. So gorgeous. If I
how about your kids? Do they like to ski?
Oh my God.
Really?
Yeah. Everybody started at the age of either 4, 5, 6, and they're begging me, especially with the weather right now. I don't know.
Not for skiing.
Not for skiing, unfortunately.
Yeah, but I mean, it's kind of your hobby. What else? Just what I want to say. I just want to ask you, what do you like if you're gonna have a dental lab, for example? I mean, have dental lab working with you. What your expectation? What your criteria for the dental lab to be successful for you?
The way we're working right now is this is a must. So what I mean is that a lot of dentists, they just, I don't know, take an impression, scan it, and they send it to a lab. Okay, make me this, and that. I think the way that our relationship is different, because most of the time, you come to the office, we see the patient together. A lot of the technicians, they only see the model, just the work that they need to do. But for me, I think the successful outcome is when we understand the patient.
It's the hardest thing. Yeah,
it is. But as long as we talk to patient and we see what they want, we can bring those expectations to as close to reality as possible. And then you see it a little bit different from your side. I see it a little bit different. Patient sees it a little different. Once we come to an agreement, I think that's the most important thing. And I really appreciate it because I know you guys are always there to support me. And I really, really appreciate that.
Yeah, but we do like different stuff. We do big stuff. But for example, if you do, let's say, single crown, and nowadays it's more digital, right? It is for you simply take a scan, send to the lab, and they finish the crown, right? For you, I mean, I know for dentists it's the chair time. It's most important because time is everything. Like we're saying, time is money, but time is everything. You can make money, you can lose money, right? But time, you can only lose. That means for you, it's most important to have, for example, a crown, put it in, no contacts, no occlusion, everything good, patient happy, right? But sometimes it's, especially now digital, right? Sometimes little click and it's not gonna work, right?
That's my most frustration, But it is life, It's what we do. It's also manual labor, and the way I look at it is that absolutely, but not just our time, also patients' time too.
Patients' time,
they're coming. Sometimes they drive far. And that's the worst for me. If it doesn't fit, and I need to ask the patient to come back again, and I don't know. I guess we're all, as a dentist, we're all perfectionists,
Exactly.
If it doesn't fit the right way, it's not going in.
It's not going in, no.
You cannot cement it, A patient has to understand it as well, We've had situations where patients are really upset at us with that, but listen, they have to understand it. They have to understand that if it's not right, if it doesn't fit the right way, and it has open margins and whatnot, we see it on the X-ray. In the future, even if it's now, it's going to be okay. In the future, it's going to have issues, and this is just not going to cement. It's not going in. It has to be redone. It has to be to our expectations. It has to be.
But like you said, the people kiss the energy drinks, Coca-Cola, coffee. how we can live without coffee? I want to ask you because I know you love coffee.
I do love coffee.
And everybody, I mean,
And I
how many
drink it.
podcasts I have? Everybody drinking only coffee. Tea sometimes, but coffee.
Yeah.
And do you have any I know you like some, I forgot what's the name of this company, but it's your favorite one, I know. And how many cups do usually you do?
Oh, that's a good question. You know, I shouldn't be answering this live.
Let's say more than 2.
Yeah, 2, more than 2 usually. Yeah,
Usually.
yeah. I don't know. It's in the morning and it's so good. It's so tasty.
It's like you got the coffee and your day starting.
Exactly,
right?
exactly.
And in the office, how's your environment in office? It's like more family, or I know you're not strict, but more family, because I know every morning you have a meeting. Everybody have to stay higher, lower, and you just start this day, right? And does it help?
You know what?
Structure.
I think it's very important.
Yeah.
You know, so that's how we start the morning. I usually come in earlier. I like to have my coffee. I like to prepare myself for my schedule for my day. There's some administrative stuff that sometimes we take care of before work, but usually when we start, it's everybody has to go through the patients, and that's good because you have to know the patient's history. Sometimes the patient hasn't been there in a long time. You have to go through the patients, and then the whole clinic as a whole, they need to know what they're doing. You know, I like to work, so everybody works in the same sort of content. Okay. For example, sometimes we have patients that need so for such a procedure, and other times we need different stuff, you know. And I hated when assistant thought they were preparing for one thing, you know, and then it's another thing, and then it takes their time. They have to run around, look for different stuff. It's usually nicer if you at the beginning of the day kind of structure it, and then everything flows more or less in a flow.
Do you usually, I mean, you prefer to do by yourself? Let's say, I mean, now it's era of digital, or your assistant or your hygiene, they do digital stuff, or you do by yourself? Like scans or any kind of stuff?
It's a very good question, you know, because these days digital, pretty much anybody can use it. I think once my assistants, they really, first I was doing everything myself, you know, because if I don't know how to fix it, if I don't know, then, you know, how can I teach somebody, or how can I, know how to, but nowadays, a lot of the things my assistants do, but they haven't really trained. I mean,
they're good.
Very good, you know, but before I send it to a lab, I always check it too, you know. A lot of the times we scan it now, you know, for the impressions for the implant crowns, and that stuff usually it's done by the assistants. I don't know, it helped a lot, you know, but also there's still the cases for the old method,
analog way,
for the impressions, especially if the margins are a little bit deeper, you know, you cannot get to it with the scanner with the camera. So that hasn't gone away, you know.
Still there. But is it easier now, less time when we become the digital era? Is it a little easier, right?
Oh, for sure.
For sure.
I mean, for sure. And you know it firsthand too, you know. You already, you know, you got the scan, and it's easier, you know, for you to put up the models to work on them, you know.
Let's say you said it when you were 21 years in the business, it was like yesterday, but you can give now like good like advice to the people, not to the people, to the guys who's gonna go, guys and girls who's gonna go through the dental school, become a dentist. What your advice? To be a dentist or not to be a dentist? To be a good dentist or not? I know, because when you become a dentist, you wanna be, and when you start working, I know some, they said, oh my God, I'm not supposed to be a dentist. Oh my God, it's so hard. You know, it's hard, right? I don't know why, but dentistry is the hardest dental, not dental.
You really have to love it.
Yeah, you have, exactly.
You have to love it. If you don't love it, it's not going to work, you know? But it's a double-edged sword, you know, because how do you know if you love it or not if you haven't tried it? You know, you can try it.
Exactly,
you can only go see observations. And it's funny that you mentioned one of the girls right now, she got accepted to dental school. She is so excited. From our clinic, you know, she's very, very excited. But I think her path started a long time ago, you know, and she really knew what she was doing, and she really wanted it, you know. I think if you want it hard enough, you will make anything work. but you really, really have to love it. It is so true. It is such a work that, patients are all asking me,
Exactly, yeah.
Victor, how do you look in your mouth all the time?
Exactly, yeah.
It's disgusting. Like, for you, it's disgusting. For me, I look at it totally differently.
But okay, look in the mouth is good, but you have to listen to the story every time, different stories from patient, because it starts, how was your day? How's your family? How's your family? And like from 20 years, probably have patients who just start, let's say, from 20, now they're 40s, and you still
And they're still seeing us.
seeing them. Exactly. And every time you go, oh, how's your wife? How's your kids? How's your grandkids, for example, right?
That too.
And then you become a family.
Exactly. And we have a lot of patients like that. They started from a dental, from the Chicago office. Now they're back here. It's nice to grow with them, and you see also you work from 20 years ago, and thank God, I don't know how, but not a lot of stuff has to be redone.
Perfect. This means something good.
Something is working. Something is working.
Well, Doc, I just want to wish you Merry Christmas, Happy New Year.
Thank you.
Hopefully, everybody will be happy, healthy, and we can do more and more teeth.
Thank you so much.
Thank you.
Thank you for inviting me. Thank you.
See you guys next year.